Hi, I'm Virginia from the Health Creators Podcast, and here with me today is Tasnim. Thank you for being here today.
Thank you for inviting me.
Amazing. It's so nice to have you here. I know we had to rearrange a couple of times, but we made it. We finally made it. So I
I
think
know
health
you're
creators,
so glad you're doing it.
yeah, I think health creators are like notoriously busy and for good reason. So
No, but this was for health reason.
yes, it's that time of year, right? So what do you do? Introduce yourself to the audience.
Okay. I do a few things, but they're all sort of connected. My first and foremost identity is being a doctor. I work as a doctor at Cambridge University Hospitals, and I also teach medical students at the University of Cambridge as a clinical supervisor. And I'm also an entrepreneur. I think the term is physician entrepreneur. So what I do is try and give people tools to have healthier lives through my health tech company called Shohai Health. And I also do health education. So try and educate patients through my videos on social media channels. So those I think are the roles, but I mean, you could say I do many things, but they're all sort of connected and synergistic. The one thing I do is help patients. So I'm helping patients while I am being a doctor at the hospital. And then I'm teaching students who will help patients when they are a doctor in the next few years. And then when I'm at home doing my videos, those are also meant for patients so that they can stay away from hospital or can go to the hospital when they really need to. And same with my company as well, where we give, um, again, accessible information for patients to manage their conditions at home and know when they need to go home, but also for people in general as well, how to live healthier lives, giving them tools for that. So also in disease prevention and promotion. So all combined, I think I work in healthcare. It's probably the
Brilliant.
one thing I do.
I love it. And you've amassed quite a big following over the past few years. You've got a few million to be exact. So what got you started to create videos?
It's grown to more than 12 million now, which is unbelievable, really. But I'll tell you how it started. So it started during COVID, uh, like it has been for many of us. So I was working at A&E as a doctor at that time when COVID started. I worked through the pandemic, through most of the pandemic as an A&E doctor. And it was one of a kind experience. It was, I mean, I was witnessing firsthand how devastating COVID was for the patients and their families. So that was how my work was. So that was my day job. And then when I would come home and scroll through social media to relax, I would get more stressed because I was seeing these posts and videos going viral with lots of misinformation like COVID's not real, it's just another flu, or videos and posts which are promoting dangerous practices as definitive cure for COVID. And those really frustrated me, worried me, especially given what I was seeing in the hospital in my day job as a doctor. And then Public Health England published a report very early on in the pandemic that the highest risk of mortality from COVID was for people from Bangladeshi ethnicity. And the risk was nearly twice compared to that of white British ethnicity. So that really troubled me. And then I thought, what can I do for my position? Yes, I am working as a doctor in the A&E, looking after COVID patients, but is there anything else that I can do for my position? And that's when I thought, okay, let's create some videos. Everyone's on social media now. With the pandemic, people are at home. These posts are going viral. Maybe if I create some videos, they will see some of it and maybe it will help make them decisions based on science, not rumors. So that was how I started. And then I was really blown away by the response because when I started, it was really meant for my friends and family in an effort so that they know how to protect themselves. And if they do get COVID, how would they take care of themselves? But people started sharing it. They shared it within their WhatsApp family groups, and then it kept circulating. And if you remember, that was a great sort of great atmosphere where community came together to protect itself, to protect each other, to look after each other. And I think those videos serve as a tool where they're using that to sort of help each other and say, okay, so this is how we can manage if you've got COVID. This is what we should do so that we don't catch COVID. And I was getting lots of questions like, okay, my mom's tested positive for COVID. How should I take care of her? But she doesn't have any symptoms, or things like, um, my dad's got diabetes and has got COVID. What do I do? Do I do anything differently? And so those questions were from a place of, oh, actually, this was a whole new situation, and there was a lot of gap in information as well. So I think because people were looking for information and there was a gap, it started sort of circulating, and then it grew to the audience that it has now.
Brilliant. And so what has kept you going since then? What has been your focus or your driving force?
Okay, I'll share two stories here. Very early on, if you remember, during COVID, we found case reports where people were having silent hypoxia, so they were not showing symptoms. But if you put a pulse oximeter on their finger, then we found that actually their oxygen levels are tanked. So when these early reports were coming in, I made a video showing how to monitor oxygen saturation using a pulse oximeter, the pitfalls, and how to get a correct reading, and when they should go to the hospital. And many people actually started doing that, and I received a message from somebody who was saying his mom was she tested positive for COVID, and then after seeing my video, he got a pulse oximeter and was measuring her oxygen levels, and then he found that actually the levels were low, although his mom was well, so he could take his mom to the hospital at the right time. And it's really stories like this that then at that time I thought I need to keep doing this, because it's actually helping people, and in some cases maybe some lives are getting saved. So that was the motivation at that time. And then as I was doing these videos on COVID, I started receiving questions on other conditions, like people were having high blood pressure, and then some topics that are taboo, like menstrual health, or things like hemorrhoids, and people do not necessarily volunteer to seek information on this. So there's a big gap, and I was getting questions on those areas. So I thought that actually the gap is not only for COVID, but there are everyday health problems and also chronic diseases where there's a big gap, and people are looking for reliable health information. And the big shift in my mindset through this experience was that I previously used to think that what goes viral is probably quick fixes, maybe medical misinformation has that appeal to go viral, but you know, we don't have miracles in medicine a lot of the time. Most of it is boring, regular stuff where you have to take care of yourself. You have to put in effort to see change, and effort for a long time. So I used to think maybe reliable information will have a place, but the virality is probably more for medical misinformation and things that are presented as quick fixes. But through this experience, what I found is actually people are quite receptive to accurate medical information as well, even if it takes them effort, time, but they're willing to put that in to take care of their health and take care of the health of their families. So that's when I thought, okay, so this is a space I want to work in, and that's when I started my company, health tech company called Shohai Health, where we work on improving people's access to reliable medical information and fight medical misinformation. And that's basically how the shift occurred from creating content from COVID to why I'm still doing it, and doing it for conditions beyond COVID. And it's amazing to see how people have been using that information. Every day I get these stories, but also sometimes some experiences are so meaningful. So I said I'll tell you two stories. The other story happened 2 weeks ago now. I was coming back to London, and this was back in Bangladesh. I had called an Uber to go to the airport. And as I was getting into the car, my driver stepped out and greeted me very warmly, and he sort of called out my name, saying Jara po kayo. I am used to getting recognized, but this greeting was quite warm, and I was slightly taken aback by how he greeted me. And then on the way to the airport, I realized probably why that felt a bit extra warm. So he shared something that was quite profound. He was telling me that he used to be a chain smoker, and then he watched one of my videos on why and how to quit smoking, and then he stopped. He hasn't smoked since. So that was something really intriguing, and that was so meaningful for me. And he was telling me that he has since then also circulated his videos to his friends, trying to persuade them to quit. And it's really experiences like this that is my why. That is why I keep going. And I think my videos are tools for people to take care of their health and also take care of their loved ones. And uh, that gives me the meaning and purpose of why I still keep doing these videos and doing the health education.
I love that. I think that's so inspiring. And I guess a follow-up question to that is, what would you advise someone who wants to get started and have this impact that you've been building over the years?
Um, I can share what worked for me while I started making these videos, and I follow these principles when I make videos now as well. So I keep three things in mind when I'm making a video. I try to keep it brief, so just containing information that people would need in their daily lives. As clinicians and people from healthcare profession, we have so much that we want to tell our patients, but many of them are probably not necessary for them and they may get tuned out. So I try to keep it brief and keep it to information that they would really need to know and implement the changes in practice. And the second thing is keeping them evidence-based so that the interventions or the changes that I'm advocating for, they really believe that those are based in evidence and they're not wasting their time, money, or effort into doing things that are not going to work. And I also try to encourage them to verify the claims that they are listening to, be that from me or from other health sources. So I try to give them the references based on which I am recommending these interventions in my videos. And the third thing I do is keep my language very, very easy to understand. My aim is if somebody has been in grade 5, or even if a child listens to my videos, they will be able to understand what I'm talking about. So using very simple everyday language so that people can understand what I'm talking about and they are able to remember and implement it in their daily lives. So those are the three principles that I keep in mind, and probably they have worked for me. And the other thing I would advise new health creators who want to create content is to start with something that they're really passionate about. So I was really passionate when I started that I want to give people information on COVID, on how they can protect themselves and protect their families. So I think finding that right match of what I really want people to know and I'm very passionate about, that is a key factor in making it successful or keeping it up, because sometimes it's very tiring and it's very grueling. So picking something that we're passionate about, I think, is quite important.
Awesome. I love that advice. I think that kind of rings true for me as well, because I was, unable to practice in the pharmacy when I moved country, and I was really passionate about travel health. And even though no one was traveling, and I was thinking, but people need to know about things like rabies and, dengue fever, because those are things that are real risks to your health when you travel, and nobody's really talking about it. And it's, something that can kill you or severely affect your health for the rest of your life. So I can definitely resonate with that. So what do you use to make your videos? Do you just use your phone? Do you have a camera? Do you have an editor? What's your kind of process?
So my process is quite simple. So when I started, it used to be my iPhone I had an iPad to record my audio. So that used to be my setup. But now I have got a camera and I've got a microphone. So I would recommend anybody who's starting to have at least two devices, one to record video and one to record audio, because when people are watching videos, the sound is also quite important. And if we use just one device, the audio might not be as crisp as if you can do too. The device details I'm not very sure about. I can come back with the details afterwards or put it in the comments of this podcast. Um, Most of my videos are basically speaking straight to the camera. There's not a lot of edits, but I've got a team who can edit videos for me in case where I'm showing demonstrations or there are B-rolls that I need to incorporate. So there is a team, and from my Shanghai Health, there's a 15-member team that we're working to build our apps and our videos and articles. But sometimes it would just be me having the having the camera on my phone doing a selfie video when it's something that I really want to push very quickly. I think a combination of methods depending on the urgency of the message and the best way to deliver the message.
Amazing. So, how did creating video content, or was this one of the factors that led you to create your app? Because your app really helps people with their pregnancy journey. And do you want to share a bit more about that?
Yes, of course. So actually, yes, it did, because as we were making videos and articles, we thought for simple interventions or simple things that we want people to know, articles and videos are great. But there are periods and conditions where we want more sort of personalized approach and more intensive support. For example, during pregnancy, people go through a 9-month journey, and for a lot of people, it's quite scary, it's new, and there's a lot of misinformation for to be mothers and to be dads as well to battle through. So having a friend at that time in the form of an app which can take them through the journey as they're progressing and telling them that this is normal, this is expected, or this is something you really should go to the doctor for, and also giving them reminders like, okay, this is your week 36, you must go to the doctor this week, and just acting as a friend. So in those areas, we thought we need a bit more than videos and articles. So that's when we thought, oh, if we can create an app where it gives them personalized information based on which stage of pregnancy they are, that would be quite helpful. And same for parenting as well, because as your kid grows, you need support sort of throughout. A kid was 1 month to 6 months, it would be very different. And so in cases where we need interventions that require personalized approach, that's when we thought apps would be useful. Same for people who are having or getting diagnosed with diabetes or high blood pressure. They would need to, it would be useful if we can take them through like a 12-week or a 15-week program to make sure that they're aware of the lifestyle changes they need to make to keep the disease under control, or even help with the remission of the disease. The other thing I wanted to share for our pregnancy app, might be slightly unrelated, is we also included a section for to be dads, because evidence shows that if the dad is involved, it improves the outcome for the mom and the baby. So every week we provide the dad with a list of things they can do. And actually, we've had great response, because I think worldwide dads are trying to get more involved with pregnancy and trying to help, but they don't have a lot of guidance as to how they can be helpful. So we were actively involving dads in that pregnancy journey, and so we heard from dads that really helped, and also moms were really happy. It was the app was telling them what to do every week that would make the journey for mom easy as well.
I love that. I think it's so important to involve the whole family, and the dad is, the other half of the parents. So it's important.
It's difficult for the mom to do. Like, I'm asking them to switch from white rice to brown rice, but it would not just be the mom, it would be the family who will need to have that change perhaps. And in that case, the conversation, if both of them are being able to advocate for that, it's probably much easier.
Yeah, I love that. And I think that, when they're both going through the journey together, it feels less isolating as well for the mum. And
Exactly.
so the dad feels like he's really taken part, and also they can, I think it leads to a greater connection in the family as well. So yeah, I really love that.
Yeah.
So another question I had for you is, when you started creating videos, did you just decide to put them on one platform, or did you decide to be everywhere at the same time? Because I think some people try to, be everywhere all at once when they first start. And for me, I tend to try and be on one place and get used to being there. And that's kind of my strategy before I go onto other platforms. Whether or not they're worth it depends on the platform. So, what was your kind of strategy with that?
I think my strategy was to be where people are because I really wanted people to know the information that I was delivering. So wherever people were hanging out, I would put out content there. Did start for me on Facebook, but then um, I think I joined YouTube fairly soon after that. Um, but I understand what you're saying as well because if you create one video, it doesn't like it. Every platform has a mind of its own almost. Like it might do well on Instagram, but not so much on YouTube. So every platform has their own sort of algorithm by which they one video will do well on one but not on the others. So it's a bit of an effort, but like I said, because I want people to get that message, say for I'm trying to in my community, thalassemia is quite common and it's something entirely preventable if you test before conception. So this is something I want everybody to know. So I will create a short on TikTok for that and Instagram for that, but I'll also create a long video for YouTube along with the short. So I think for new creators, shorts would be a good way, which now are we can put across all platforms. So YouTube, Instagram, TikTok, Facebook, all platforms seem to be promoting shorts. So shorts would be a good way for new creators to go. But also now there's an option of linking the shorts with long form on YouTube. So people who are intrigued by the short can click on the long form and get the message in full and understand the nuances as well related to it. And you can point to the long form in the shorts as well if needed. So I think there's merit in being on all platforms, depending on the message that you're delivering. But the audience is also different on different platforms because I think YouTube audience is more sort of long form versus TikTok is very quick. And if you don't get their attention in 1 second or 2 seconds, then that's it. So depending on the kind of message we are delivering, I think we can choose the platform versus if you're creating shorts, I don't see any harm in putting them in all platforms and seeing which formats, which kinds of content your audience is expecting from you on those platforms.
Perfect. So what kind of volume of videos do you create? Do you create like one a week, or is it kind of just as and when you need to? Because you've got quite a backlog now, so I feel like there's less pressure to create your catalog of videos. So how often do you create a video?
It was quite frequent during COVID, but I wouldn't be able to maintain a schedule of one a week or two a week, which I know is good practice, as advocated by a lot of content creators, but this is just not something that is feasible for me. So I sort of do it as and when, but I do prioritize when if there's say sort of new information that really needs to reach people urgently. For example, when we knew about the vaccines and the trials were coming out showing they're effective, I would then do it quite quickly. Maybe on that same day, I would try to create a video to make people aware. Recently, we've done a campaign with UNICEF Bangladesh where we were encouraging people to get the HPV vaccine. So there was a campaign for a short amount of time where the vaccines were being given for free in schools and also outside schools. So that's when when things are time sensitive, I would prioritize. But for regular content, it would be this schedule.
Yeah, I think there shouldn't be a pressure to create videos unless you've really got something to share, because I think sometimes you can get really caught up in trying to think of lots of ideas and then you have too many ideas and not enough time to make them all. And it's kind of like self-defeating. So
But there's some merit in having a regular schedule as well. I think you that motivates you to create regular content and sort of asks you to think about what are the things that people might want to know from me and get you started, get you going. And regularity, it helps. And I think the process of creating content is also really educative For me, I think that really helps when I see patients face to face in my hospital, and I can communicate with them better because I've been trying to speak their language. And also, so I think it's a very synergistic process. Things that I find in my hospital in my day-to-day experience informs my health education videos. And again, when I'm researching that for the health education videos, trying to find out examples, analogies that would work for that will work when I am doing remote communication. Also, some of them I can use in face to face and make communication easier. So I think there's merit to both regular schedules or doing as needed.
Yeah, I love that. I think I definitely find that through creating videos, I've become a better communicator, but also I'm a writer as well. So that kind of overlaps. So does that kind of help inspire your students as well? So do your students kind of watch you create health education videos? Do they find that they want to include it in their future practice, maybe when they become qualified?
Yeah, some of them are really interested, really engaged, and I think overall we are seeing more and more clinicians and healthcare professionals come onto social media and engage. And I think that's so important because there's so much information and medical misinformation online that it's very difficult for people to know which is accurate and which is not. And we cannot expect that everybody will know the scientific method and will be able to critically appraise each claim. So we do need more and more experts to engage on these platforms, break down the complex topics and explain it in easy to understand language. So I do see a lot of interest from my students to um, who are interested in this process and who are exploring health content creation.
Brilliant. So next
Sorry,
generation.
sorry. Do you see that in the pharmacy world as well?
Well, I'm not actively practicing in pharmacies anymore, but I do see more pharmacists creating accounts and sharing information, and even students as well, pharmacy students, they tend to add me on Instagram and stuff. And so it's quite nice that they're seeing that, there is a lack of pharmacist presence as well. And I think people always have questions about medicines, and especially when there's a big medicine that's out there all the time, the injectable um, GLP-1 medicines
Right.
and other medicines that, their names get thrown around a lot. And it's very seasonal as well. So if you talk about medicines at different times of year, people will find your content really helpful there. And also you're quite limited when you're in the pharmacy with how much time you have with your patients. So if as a student you're already thinking ahead and maybe you're a little bit time pressured and you want to offer a video to your patient as part of your care,
Mm-hmm.
then I think that's a great way forward because you know the content of the video because you made it. And not that the video would be a substitute for the care, but it would be for reinforcing the education.
Absolutely, yeah.
um,
Things that they can take home and because they would it's difficult to remember everything the doctor or the pharmacist said. So it's really nice to have an aid as well.
yeah, exactly. And I think even when I was trying to learn more about travel health, there were no videos at all about it. And most of them were in the context of kind of endemic regions
Mm-hmm.
and not really made for people who are traveling where the disease is not endemic.
Mm-hmm.
And so that was the other kind of um light bulb moment for me. I thought, oh well, if I create this, then it'll be a resource for even, future pharmacists, future doctors who just want something quick and easy to understand as well. Because I think
Mm-hmm.
there's a lot of written information, but it's been shown that visual, audio, and video information is really much easier for people to understand. And I think that's why misinformation spreads so quickly, because if it's in video and a person is speaking in a really convincing way, then that's it. People are convinced, which is, it seems too easy. So
But we need to do the same with like reliable information, like you're doing with, like you have done with travel health, where you also break down the myths and just address the concerns people have and how they can protect themselves. That's so cool.
Yeah, thank you. I think also it supports what people would say in the pharmacy. So if you've got your pharmacist in front of you in the pharmacy or your doctor in front of you, and then you go online and the doctor says the same thing or the pharmacist says the same thing, then it reinforces because you've kind of got that second opinion
Mhm.
independently. Like, they don't know each other. They might not know each other, or they might, you don't know. But people like to get a second opinion, and I think people feel like they have the right to know certain information and they're going to find it somehow, and the first place they'll go is the internet. So
Yes, yes.
it's a great help but also a great hindrance sometimes, but we're working on it. The more of us there are, the better. So that's the point of this podcast, is try and get more people into it. So,
The more exactly, I mean, I think we can't battle misinformation. I mean, it will always be there. It has been there before social media, and it will. Social media probably just brings it closer to our eyes or to our phones. But as long as there's also credible information on that same platform by experts, then people can make their own decisions, and that's it. That's what we want to do.
yeah, I love that. Well, thank you so much for your time today. It's been really helpful and really inspiring to speak with you.
It was so lovely. Thank you so much for having me. Always great to catch up with you.
Thank you. I will leave all of your links in the description below. So thank you to the audience for watching or listening. If you want to check out all of Tasnim's stuff, you can check it out in the description below, and we'll see you at the next episode.